eye conditions heal best with eye ointment. Using eye ointment can feel a little trickier than using eye drops, and it can seem messy if you're not familiar with the proper technique. This video shows you some techniques to instill ointment in your eyes easily and smoothly. Check your ointment instructions for the proper dosage. Check the ointment for the expiration date. Before you begin, wash your hands with soap and water and dry them. Place a clean tissue on your table. This is a clean place to rest your ointment tube and cap, as it is important to avoid any contamination with germs. Position yourself. When applying eye ointment, it is best if you watch yourself in a mirror. You may stand in front of a mirror. You may also sit down in front of a cosmetic magnified mirror so that you can rest your arms on the table and stabilize your hands. If you have poor vision, try a mirror which is illuminated. This may help you see better. Ointment can be sticky and may shoot out of the tube as soon as you remove the cap. To avoid this, do not squeeze or press the tube until you are ready to put ointment in your eye. First, with the cap on, pick up the tube and hold it in your closed hand for a few minutes. This will help soften the ointment and make it easier to use. Open the tube and place the cap on a clean tissue. Gently pull down your lower eyelid to expose the inside pocket of your eyelid. Angle the tip of the tube into the pocket of your lower eyelid while you watch yourself. Even if your hand shakes, the tube tip will not hurt your eye. Gently squeeze the tube to allow a small string of ointment to fall into your eyelid pocket. You only need to instill a little strip about 1/4 of an inch long, or a blob of ointment. Then move the tip out as you first look down and then close your lids over the blob of ointment. Take your finger away after you close your eyelids. Keep your eye closed for 2 minutes after installation. This allows the ointment to melt and spread smoothly across your eyeball. While the ointment is melting into your eye, you may use the other eye to close the tube and set aside. Take care to avoid touching the tube tip to your lid, eyelashes, or eyeball. The tube tip needs to be kept clean and free of germs. Do not blink your eyes for 2 minutes after you instill the ointment. If you do, most of the ointment will be blinked off the surface of your eye. Do not fill the entire lower eyelid pouch with ointment. That is too much, and most of it will spill off the surface of your eye and be wasted. If any ointment spills over onto your skin, gently wipe it away with a clean tissue. Your vision will be blurry for a while after using ointment. Do not plan to use ointment just before you read or drive. Another way to instill ointment is to use a cotton-tipped applicator. Take a clean cotton-tipped applicator. Squeeze a small blob of ointment on the cotton-tipped applicator, about the size of a grain of rice, and close the tube. Now, pull down your lower eyelid and use the cotton-tipped applicator to put the ointment into the pocket in the lower eyelid. Look down, close your lids to trap the ointment in your eye, and then remove your finger from the lower eyelid. Eye ointment is often prescribed for use at night before you go to bed. If you find it hard to instill the ointment yourself, you may ask someone to help you. If you are prescribed both eye drops and eye ointment, the drops always go in first. Wait 10 minutes before you use the eye ointment. Do not use contact lenses while using eye ointment. For some eyelid conditions, your eye doctor may ask you to use the ointment differently. For lid infections, you may be asked to rub the ointment onto your eyelid margin. Close your eyes while you do this. Take a small bead of ointment on your clean fingertip and gently rub it into the skin of your upper and lower eyelids at the base of your eyelashes. After eyelid surgeries, your doctor may ask you to use eye ointment over your surgical wound. Take a small bead of ointment on your clean fingertip or cotton-tipped applicator and gently spread the ointment on the skin around the wound. Learning to use eye ointment correctly may take a little effort. Be patient with yourself. With practice, everyone gets better.